Good morning. I have my homemade Starbucks. I wanted to make this video because it is my last day up here at Mayo Clinic, trying to find the answers for me. Some of you have known and followed me on other pages and things for quite a while, but for the most part, this is kind of a fresh start with Breakthrough Explorer. I am just trying to figure out how to live a quality life in the body that I have. And I have been going to, so let's start with a little bit of a backstory. So I've been going to various different neurologists and neurosurgeons since 2016. Actually, I fell off of a ladder changing a light bulb at home in February 2016. They sent me through physical therapy because I was having pain in my neck, shoulders, back, all of that. Was losing feeling in my arms and hands, was having just this burning constant pain, zapping that was happening in my arms, in both sides of my arms. After an MRI, they found out that I had a herniated disc in my C5, C6. So that started my journey to go see all of the neurologists to get answers. So I ended up seeing a neurosurgeon. They did a anterior discectomy cervical fusion, where they put a little piece of plastic, really, to replace the disc that is herniated and that was pushing on my spinal cord, which was causing all the problems in my arms and hands. And then they fill that little piece of plastic with a donor bone. And then that donor bone, crushed donor bone, then that donor bone then grows and attaches itself to the vertebrae above and below it. And then they screw a metal plate in there with 4 screws made out of titanium or whatever. So I have had that since 2016 in the fall. After I had the vertical sleeve surgery in the fall of 2017, I was working out, I was doing all the things, I was losing weight, things were going really well. In the beginning of 2018, I started noticing pain in my arms when I tried to lift weights, and I was just so fatigued. I really, really struggled with losing weight after that. The fatigue has been one of the biggest factors of my weight loss stall, because I just don't have the energy, and my body just crashes. It just flat out crashes. Anything I try to do, I just crash. So anyway, so that was the start of it all. So in end of 2018, I started getting numbness, tingling in my lips, nose, cheeks, tongue, throat, and they labeled it paresthesia. And so the paresthesia kind of then prompted me to start going to different neurologists again to see what was going on. So they referred me to one up in Des Moines, Iowa, and he didn't want to do any testing. He barely even checked any reflexes, and just said, "Here, take this medication," which gave me a very, very bad feeling. I don't like to take medication. I'm on plenty for various other things, and I will talk about that at some point too. But so I just don't want to be throwing medication at something that I don't know what it is, and he didn't want to label it as something. So onward to a hunt to a different neurologist. So then my doctor referred me for a second opinion to another neurologist that did all of the tests. They I would go in like maybe every 3 months or so, tell them the same symptoms that I was having. They checked my reflexes yet again, and they would always be the same. And then they would do, they sent me for more MRIs of my head and my spine, of my cervical spine. They didn't seem to check anything else, because at that time I wasn't really having problems with my legs. So after a year of seeing that neurologist, and he never really prescribed me any more medication. And so I had not been taking gabapentin for a very long time, still dealing with all the pain, the paresthesia, all that stuff. No medication. And then after he did the EMG, which is they stick needles in you and test your electrical circuits to make sure that there's no spinal cord damage. After he did that test, and the guy that the neurologist that did the test said the likelihood is that you have fibromyalgia, but I'll let the neurologist tell you that. Well, when I asked the neurologist, he said, I can't give you that answer. You need to see a rheumatologist. So he referred me to a rheumatologist that I started seeing. Immediately when I seen him, he started diagnosing me with a few things. So fibromyalgia was one of the first ones. Chronic CRPS, chronic or complex regional pain syndrome, was the second thing, mostly in my arms, because everything was in my arms at that time. I was having aches and pains all over, but I figured I was getting older, and the fibromyalgia, I had all 18 points at that time too. And then fast forward for about 6 months later, after the diagnosis with fibromyalgia and the CRPS, I started having trouble with my legs. I went to my primary care physician because I couldn't get into the rheumatologist. They referred me to physical therapy, so I ended up doing physical therapy for about three months or so, about once a week, and doing the exercises outside of that to just get stronger, because that's what I said. I said, I know you can't fix me. I said, but I just want to get stronger. And so that's what we worked on. And that led up to December 2019. And then in January 2020, I was working a ton of hours, and in the middle of the month, there was a time when I couldn't get up from my desk chair at home. I had started at the beginning of the year working from home full time because it was so cold, and just leaving my home and going out into the weather was incredibly painful. And so I started working from home all the time. But I got to where there was a day that I just couldn't get up out of my chair. And when I did get up out of my chair, I couldn't stand up straight. And I was just in absolute terror and pain because it hurt so bad. Like I knew that there was something wrong. And so I went to called someone to take me to the ER. They just said it was my fibromyalgia. Gave me a couple shots, sent me on my way. They didn't do any x-rays or anything. Said follow up with my primary. Couldn't get in with my primary, so I seen one of the other doctors in her clinic. And from that point on, it just started a whirlwind of whatever, of a fight that I knew that I had to take on because I wasn't getting answers that made sense. So when I seen the primary, she said that I had sciatica, and that there was these physical therapy exercises. She gave me these sheets of paper and said, do these at home. And at that time, and each time that I had went, when I went to the ER and when I went to that doctor, I had told them that I was starting to have problems with my bladder and my urinary system. And so they should have been doing more tests then. And what So then a couple weeks later, it was still going on. So we were at the beginning of February at this point. I was finally able to get into my primary. And so when I went to see my primary doctor, she's like, they didn't do any testing. And I was like, no, they didn't do any testing. Nobody sent me for x-rays. Nobody did anything. And here I was with a walking stick, barely able to walk into the clinic at this point. So she sent me down to do x-rays at that clinic. They read the x-rays, said, oh, there doesn't look like there's anything wrong. We're going to send you to do to go see your rheumatologist. So I went to the rheumatologist a couple days later, because I actually still had that was when my next appointment was anyway. So I went ahead and seen him. And at that point, they said that, oh, well, it's probably this or that. And so they did some more different kinds of x-rays. They did a whole ton of blood work, and then started me on the drug methotrexate. I don't know if you know what methotrexate is, but it is a medication that is an immune suppressant, that is supposed to stop your body from attacking itself, apparently. It's kind of like in the line of chemotherapy drugs. And I was like, what's going on? I mean, this would just come on that suddenly that it would be necessary to do this. Didn't really get much answers. Decided, okay, go back to my primary, say this doesn't seem to fit. So I went back to my primary care doctor. I said, you need to get me to somebody else that can evaluate me. She's like, let's go to the orthopedic. I'll order some MRIs for your lower lumbar, see what's going on. And then so I finally was able to get into an orthopedic surgeon, and they were able to do some MRIs there. So when they did those MRIs, they found a torn disc in my lower back, some inflammation going on, but no arthritis or anything in my hips or anything like that. So that was in February of 2020. For the next 5 months, I still, they really didn't do anything other than refer me to pain management that could not get me in right away. And then COVID hit. And what happened then was that it just made everything, halt. There was no appointments, no nothing. So luckily I had made a pain management appointment in May, and they never canceled it. So I went ahead and went to the pain management doctor in May, and on May 18th, and they did an injection into my L5 disc space, where they could see the tear on the MRI from February. About 10 days later, they told me to call back and let them know how I was doing. Still doing pretty shitty. And so they were going to follow up with more. So I went back up there, had a visit with them. They were going to do more testing. They wanted to see my full view of the spine. They wanted to see my cervical spine, my thoracic spine, and my lumbar all at once. I'm like, okay, this sounds like the right thing. But 2 days after that appointment, I got a call from Mayo Clinic. Back in February, I was at my wit's end. I thought I was losing my mind. Some of my doctors had told me that this was all in my head, and that it was my bipolar or my depression that was causing it. Because I was super stressed out. I was crying, emotional. I was in severe pain, and it felt like nobody was listening. I'm going to try not to cry. But anyway, so back in February, when I had reached out to my primary doctor, and she decided that there wasn't anything else that she could do for me. At that time, I'd already reached out to attend a outpatient cognitive behavioral therapy program, to get some assistance with getting my mind back into a state of rational thinking, because I just wasn't at that point. And when my primary care physician told me that it was all in my head, I lost it. I was in tears by the time I walked out of that clinic. And she told me, she has told me before that she's a mental health, she's certified to treat mental health patients, which is scary because there was no care or concern when she said that for me, and she let me walk out of that office in a state that was very, very dangerous. And so beyond that point, so when I was at the outpatient treatment program, I said, I just need to find answers. Like, there is something wrong in my lower back and nobody is listening. And I ended up going on to the Mayo Clinic website and clicking the button that I was looking for to request an appointment. And so I put in there every single thing that I have dealt with: my bipolar, my PTSD, my anxiety, my pain, all the doctors that I had seen, all the answers that I did not have, all the diagnoses that they did try to give me, and all of them that they tried to change, add on and add on and add on. And I'm like, this doesn't seem right. I said, I need somebody to look at this from top to bottom to see what the heck is going on with me, because my quality of life has gone from one summer of feeling pretty damn good and feeling like, okay, I can get a handle on this, to 6 months later, I can barely walk. So yeah, I had a couple follow-up phone calls with them, and they said that, at one time I got an email that I was declined to go to the Mayo Clinic, that they didn't approve my case, and that was kind of defeating. I'm like, oh shit, that just means that I have to keep pushing this orthopedic for answers, because I didn't feel like the rheumatologist was doing the right thing. And so that's what I did. Once I finally got into the orthopedic, I was like, okay, I can just hang on until May. And they finally figured, I guess those 2 days after I had the appointment with pain management, and they decided to call me to say that I was approved to come up here to Mayo Clinic, I finally felt a little bit of hope. I've had to keep an open mind, an open heart. It has been one of the hardest things that I've ever had to do. I've been staying up here mostly by myself. My folks brought their travel trailer up and camped, but I've been in a hotel suite by myself, and going to all the appointments and everything. And I'm going to get emotional, by myself. But that's how I do life, is as a single mom. Everything is done by myself. It's my responsibility to take care of me and to take care of my family. So that's what I do. And so even during these 2 weeks, that's what I've done, is to take care of me so that I can be there for my son. That's it. Bottom line. That's all that matters. Anyway, so once I got up here and they sent me through MRIs, they referred me to additional MRIs. They had originally scheduled only the cervical MRI and cervical spine CT. And then they decided that they wanted to see the whole thing. And then they sent me to gastroenterology for some follow-up on some of the questions that I had there. I seen a neurologist. I seen a regular primary, like I would consider a primary doctor. He's actually an occupational doctor, but he does cover for internal medicine. So I seen neurology. I seen rheumatology and orthopedic, pain management. And today, on my last day, I'm going to be seeing having a sleep consult and another round at pain management. And they have ran the gamut of tests on my spine, have found out the problems. Oh, and the Fibromyalgia clinic, which was the biggest one for me. I felt like it was the one that gave me the most hope, which seems crazy because fibromyalgia is one of those diagnoses that has no treatment, and is just basically living with a whole boatload of symptoms that varies from any day to day, and you never know when a good day is going to be here and when a good day is not. So yeah, it's surprising that it gave me hope to go to that clinic. And then the pain management people have been great. They are treating different inflammation spots along the nerve root that is affected in my lower back. So the other day they treated a bursa sac on my left leg that was causing, like, it just hurt so bad, and that has started to, I'm feeling some relief from that treatment, which is, I'm so grateful for, very, very, very grateful for. I have the other two today that will be going into my piriformis and my SI joint to do another injection, I believe 2 injections there. And then we'll go from there, from that perspective. The other thing that they're doing for treatment wise is that they referred me to a chronic pain rehab program, which is a 3-week program, and I will talk more about that in another video since this one is getting so long. But I guess all that to say that is, I am so grateful that I decided to reach out to the Mayo Clinic, because I feel like they have actually cared about getting to the bottom of what's going on. They don't want to just throw medication at me. If at any rate, they want to get me off of things. They want to change things around a little bit. Told me some conversations to have with my doctor and my various doctors about different ways to tweak the medications so that I might be able to move off of some of the other ones, and see how it goes. So those are more things to come, but overall, this visit at Mayo Clinic has been life-changing, eye-opening, and something I desperately needed. I'm still very emotional about what is to come in life, because there's a lot of change that I have to make, and change isn't always easy, and change is scary, and when you're doing it on your own with supportive friends, of course, it makes it a little bit more scary. I'm not gonna lie. So anyway, thank you for listening. If you have any questions about working with the Mayo Clinic or getting connected with them, I will put the link to the Mayo Clinic down below, so that you can request an appointment with them. They are available across the US. There are, I think, 3 or 4 different facilities. I'm at the one in Minnesota because it's closest to Iowa. And it has been a great experience. Nothing but good things to say about them. You might always not get the answers that you would really like to hear, that there is a cure or there is something definite that they can do to fix you. But that doesn't mean that it's not worth fighting for the answers and advocating for yourself to give you that your own peace of mind around what's going on. There is not a reason to not do that, if that's what you need mentally, because that is so important to keep your self in the forefront. And I will be sharing more about the ways that I'm going to be changing some habits and processes in my life to put myself first more, which is going to be a very difficult process when I haven't really done that for the last 41 years. So thank you for listening to this extremely long video. I will start doing some smaller ones around the different diagnoses that I got while I was here, just so that I can just break those down into smaller pieces for consumability purposes. But anyway, thank you guys for listening, and I hope you have a great and fantastic day.